Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning, it's a real treat, Dr. Aaron Feinauer, the pharmacy manager at Covenant Healthcare. Thank you so much for being here. How are you, doctor?
I'm good. Thank you for having me back.
We're so delighted that you're here. Doctor, we are talking all about the COVID-19 vaccine and some common questions that people might have. So, doctor, I understand that since receiving the first COVID-19 vaccine shipment back in December of 2020, Covenant has given out more than 40,000 shots in arms. So what's your approach at Covenant?
Yeah, so I mean, we try to make it as available as possible for it. So we had our mass clinics at Horizons Conference Center for it. We've been doing it in our MedExpress locations, and we've been rolling out to offices. So trying to get it in as many locations as possible to make it easy to get.
Love it. That's how it works. Doctor, now, for those wondering and they're still a little hesitant, can you tell us a little bit about how the COVID-19 shot works? Is it safe, and does it actually work? Is it effective?
Yeah, so we're actually seeing really great efficacy still in the real world. So even above that 95% that kind of Pfizer, Moderna were first advertising through their studies for it. In-house, we're not seeing new cases really coming from the fully vaccinated population. So it's effective. It's effective in all the populations that we're seeing for it, especially with the 12 years and up now that was approved not too long ago. So we're definitely seeing great efficacy still for it. In terms of safety as well, we continue to see good safety data from it. The main side effects being the pain in arm, the fatigue, the muscle weakness and pain, but really nothing severe coming from these vaccines. And now we're looking at, 7-8 months out from it when we were first getting it in terms of the studies and in our hands for it. So really great safety, really great efficacy.
That's great. I want to reiterate this now. I had the vaccine, and my daughter also, she's 14, she had it, and I was good to go. I only had that sore arm after both doses. Are there any other side effects that, some people are worried about out there?
Yeah, I think the big one is just still, is the second shot going to knock me out? Am I going to be, out and down for a week? Am I going to be so sick that I can't do anything? And while those are some, very extreme cases, it's very few and far in between. Most people can tolerate it just fine, or the second dose, they're tired, they're out for 24 hours or 48 hours at most, but they're back at it, they're back to work, they're back to having fun. And especially in summer, I think everyone doesn't want to waste a weekend. So, the people who are waiting for Friday to get it don't want to waste a Saturday, Sunday, but we're just not seeing that.
Yeah, that's true. I was back at work, a few hours, good to go. Doctor, so are there a few facts that you'd like to share about the COVID-19 vaccine that we have not talked about already?
Yeah, I think the big thing is that we're still seeing great efficacy against the variants that are coming out. There's, I think, a lot of concern and discussion about all these different variants that are still popping up because of this uncontrolled spread around the world. That this vaccine might not do its job against that, but the experts are studying that, they're monitoring that, they're still seeing great efficacy against those variants. And so I think that's important to know. I think some people might be on the fence to say, I'm going to wait till the next one comes out, and there might not be a next one. It's still good enough for what we're having and what we're seeing. So I think that's important to know.
I love that, because a lot of people are hearing about that Delta variant. They're like, oh my goodness. So it's safe, it's effective, the vaccine, it works against those. Now, doctor, if someone is eligible to get the vaccine, but they're still, like you said, on the fence, what would you say to them? Encourage them to get that.
Yeah, I mean, I say go talk to your pharmacist in your store, go talk to your doctor about it, and have some good conversations about it. But I think if they want to know what I would say to them for it, I'd say there's really not a good reason to not get it right now for it, especially if you haven't been vaccinated or you don't know your infection status for it, you've been infected. It's still a good idea to go get that vaccine for you to help control the spread, help protect those around you, especially for me. I've got 2 younger kids, 2 and 4 years old, that aren't eligible for the vaccine yet, so I want to make sure everyone that I'm around is as vaccinated as they can be, getting those completed series to try to protect them and protect that population that can't get the vaccine. I think that's still something that we got to be mindful of. Michigan just passed the 62% for population with at least 1 dose. So we're still far away from that herd immunity that we're shooting for, that 70-80%. So there's still a long way to go.
I'm with you, doctor. My son's 11 years old. He's right there at that age where he's not ready for it. I know. So I'm like, everyone I know, get the vaccine. Doctors say it's safe, it's effective. So we want people to get the vaccine. Doctor, are there still vaccines that are available right here in our area?
Yeah, so again, at Covenant, we have multiple doctors' offices that are getting it. We are still doing our 3 MedExpress locations, Saginaw Valley, Hemlock, and Frankenmuth. The health department here in the county is still running clinics. There are major retailers in every corner. Any pharmacy on the corner is going to have this vaccine, too, to go get for it. So access really just isn't the issue anymore. It's available just about anywhere you can go.
Yeah.
Still mobile sites and clinics happening around the area.
I love it. So it's out there, it's available for you. Doctor, anything else we haven't covered that you would like to add? You're very thorough, but anything else?
Not that I can think of. Just again, if you have questions, you're on the fence, ask your pharmacist, ask your doctor, ask your provider, should you get the vaccine, or what are the reasons why they would recommend getting the vaccine, and have that conversation, have the tough conversation with family members or friends that might be on the fence. If you're in a position that you can offer advice or just share your experience, how it went for you. It went great, it went fine, put some nerves at ease.
That's great. I love to hear it. Yeah, for me, I was good to go. A little shot, a little pain in my arm, and I was fine. Doctor, thank you so much for spending the morning with us. We appreciate you answering all these questions. Thank you.
Hey, thanks for having me back. Appreciate it.
Of course, you're welcome. If you'd like any additional information on today's topic, just head on over to the Hot Links page. That's at WNEM.com.